So what happened with Sammie was that we put her to bed in the evening, everything seemed okay. The next morning when we got up to take her out of her bed, she just wouldn't get out of her bed, she just sat there. At first it was shocking to see from the previous night being a healthy dog to being just a dog that could barely walk. Kind of knew straight away there was something up, so he just had to go to the vet then.
Sammie came into one of our clinics on a Saturday morning. She was very sick on arrival. She had been perfectly normal the day before, had gone to bed as normal, but was very weak and lethargic on Saturday morning. The owners brought her in as an emergency. She was in a collapsed state, or near collapsed. She was very pale and obviously was losing blood. Now there was several possibilities that we had to investigate, but after doing a series of tests within the clinic, we knew within a few hours that we were dealing with a bad case of lungworm. Sammie was bleeding heavily into her abdomen.
So when Martin diagnosed Sammie with lungworm and gave us a 50-50 chance of survival, we were quite upset and shocked because we would never heard of lungworm or the effects of lungworm on dogs.
Dogs contract lungworm from infected slugs and snails, either from licking and chewing the slugs and snails or from contact with their slime trails. The slugs and snails then become infected from contact with the dog's feces. Foxes are also an important carrier for lungworm. A recent survey in Ireland showed that up to 40% of foxes in the country are infected with lungworm, and in Galway the statistics were even higher. The signs of lungworm often are not apparent. Dogs can be affected without showing major signs for a long time, but when they do become sick, they usually are affected with either breathing problems or bleeding problems. More serious side effects of lungworm infection are bleeding problems. Dogs can suddenly bleed externally, they can bleed internally as well. Sammie stayed in the clinic for a couple of days and thankfully made a complete recovery and is now back to full health, but she certainly was touch and go for the first 24-48 hours.
That morning when we first saw her, we didn't think we'd see her again. We kind of thought that she was so sick and so ill that we thought, could have been it. But when you see her now just out the back playing with Belle, her sister, and running around the fields, playing pitches, we're just happy to have her, basically.
We've had a few cases of lungworm in our practice in recent years, and the recent case of Sammie shows how dangerous lungworm can actually be. Nowadays there are methods of preventing lungworm. You can ask your local vet about what monthly preventative options there are. We know that it is in the area, and we know from statistics that there's a high level of infection in the local foxes.